The surgeon who failed his operation and left him blind never expected to see him again. But 20 years later, he woke up on the operating table, staring into the eyes of the patient whose sight he had destroyed. Dr. Marcus Chen adjusted his surgical loops and reviewed the patient file one final time before entering the operating room. At 32, he was one of the youngest and most respected ophthalmologists at Stanford Eye Institute, specializing in complex retinal surgeries that other doctors deemed impossible. His steady hands and innovative techniques had restored sight to hundreds of patients, earning him recognition as a rising star in the field of ophthalmology. What his colleagues didn't know was the deeply personal reason behind his relentless pursuit of perfection. Behind his left ear, hidden beneath carefully combed hair, lay a small scar, the only visible reminder of the surgery that had changed his life forever. The case before him was challenging. A 70-year-old retired surgeon suffering from advanced diabetic retinopathy with severe complications. The patient had lost most of his vision over the past year, and this surgery represented his last chance to avoid complete blindness. Marcus had reviewed the imaging studies multiple times, planning every incision, every movement with meticulous precision. "Patient is prepped and ready, Dr. Chen," announced the surgical nurse as Marcus entered the sterile operating room. Marcus approached the operating table, where the patient lay under local anesthesia, conscious but sedated. As he positioned himself at the surgical microscope, he glanced down at the patient's chart one more time. Dr. Richard Hoffman, retired ophthalmologist. The name stopped Marcus cold. His hands, usually steady as stone, began to tremble slightly. After 24 years, he was face to face with the man who had destroyed his world. Dr. Richard Hoffman had been at the peak of his career when 8-year-old Marcus Chen had been rushed to the emergency room with a severe eye injury. A baseball had struck Marcus directly in the left eye during Little League practice, causing what appeared to be a straightforward retinal detachment. It should have been a routine surgery for an experienced ophthalmologist like Hoffman. But that night, something had gone terribly wrong. Marcus could still remember the smell of the hospital, the bright lights overhead, and his parents' worried faces as they signed consent forms they couldn't fully understand. His mother had held his small hand and whispered in Mandarin that everything would be okay, that the doctor would fix his eye and he would see clearly again. The surgery had lasted 4 hours instead of the expected 2. When Marcus woke up, his left eye was bandaged, and the doctors spoke in hushed tones with his parents in the hallway. Days passed before anyone would tell him the truth. The surgery had failed catastrophically. Not only was his injured eye beyond repair, but complications from the procedure had caused sympathetic ophthalmia, a rare condition where the immune system attacks the healthy eye. Within 6 months, Marcus Chen was completely blind. He remembered the moment the last of his vision faded away. He had been sitting in his bedroom, holding his favorite book about astronauts, when the remaining shadows and light shapes disappeared forever. The world became an endless, silent darkness that no 8-year-old should ever have to navigate. Dr. Hoffman had visited the family once after the diagnosis was confirmed. Marcus couldn't see him, but he remembered the man's voice, deep, tired, defensive. He had explained to Marcus's parents that these complications, while rare, were known risks of the surgery. There had been no malpractice, no negligence, just an unfortunate outcome that occurred in less than 1% of cases. Sometimes, Hoffman had said, his voice carrying a mixture of regret and self-protection, medicine humbles us all. The family had considered legal action, but the medical review board found no evidence of wrongdoing. Hoffman's surgical technique had been textbook perfect, his decisions medically sound. The catastrophic outcome was simply what medical professionals called an act of God. One of those devastating complications that could happen to even the most skilled surgeon. But for 8-year-old Marcus, it wasn't an act of God. It was the moment his childhood ended and his life took a completely different path. The years that followed were the hardest of Marcus's life. Learning to navigate the world without sight required completely reimagining how to exist. Simple tasks like eating, dressing, and moving through his own home became monumental challenges. He had to learn Braille, master mobility techniques with a white cane, and develop heightened senses of hearing, touch, and smell. School became a battleground. Despite legal protections for disabled students, Marcus faced constant challenges from teachers who didn't understand his needs and classmates who saw him as fundamentally different. He excelled academically. His memory and concentration, sharpened by necessity, made him an exceptional student. But the social isolation was profound. It was during his sophomore year of high school that Marcus discovered his calling. His biology teacher, Mrs. Patterson, had taken extra time to describe the intricate details of human anatomy in ways that Marcus could understand through touch and detailed verbal explanation. When they reached the unit on sensory organs, she spent days explaining the magnificent complexity of the human eye. The eye, she had told the class, is essentially a biological camera, more sophisticated than any technology we've created. The cornea focuses light, the iris controls the aperture, and the retina converts light into electrical signals that the brain interprets as vision. As she spoke, Marcus felt something awakening within him. The very organ that had betrayed him was also the most elegant and complex structure in the human body. He began reading everything he could find about ophthalmology, learning through audiobooks and Braille texts about the latest advances in eye surgery, genetic therapies, and artificial vision research. His parents were initially concerned about his obsession with the field that had caused him so much pain, but Marcus's determination was absolute. "I'm going to become an eye doctor," he announced during his junior year. "I'm going to make sure what happened to me never happens to another child." The path was extraordinarily difficult. Medical school admission committees were skeptical about accepting a blind student into a surgical specialty. Marcus faced rejection after rejection, with admissions officers questioning how someone without sight could possibly perform the precise work of an ophthalmologist. But Marcus had advantages that sighted doctors didn't possess. His sense of touch was extraordinarily refined, allowing him to detect subtle changes in tissue texture and tension that others might miss. His hearing was so acute that he could identify different types of surgical instruments by their sound alone. Most importantly, his understanding of blindness from a patient's perspective gave him insights that no textbook could provide. He was finally accepted to Johns Hopkins School of Medicine, where he excelled in every subject. His professors were amazed by his ability to learn complex anatomical structures through tactile models and detailed descriptions. He developed innovative techniques for learning surgical procedures, working with cadavers and simulation models to understand the spatial relationships of ocular anatomy. The real breakthrough came during his residency at the Massachusetts Eye and Ear Infirmary. Working with cutting-edge surgical microscopes equipped with voice-guided systems and enhanced tactile feedback, Marcus discovered that he could perform certain types of eye surgery with remarkable precision. His fingers, guided by years of heightened sensory development, could detect minute changes in tissue that even experienced surgeons might overlook. His first successful surgery, removing a cataract from an elderly man who hadn't seen his grandchildren clearly in years, was a triumph that brought tears to everyone in the operating room. When the bandages were removed the next day and the patient could see again, Marcus knew he had found his purpose. Now, 24 years after losing his sight, Dr. Marcus Chen stood over the man who had changed his life forever. Dr. Hoffman lay unconscious under light sedation, unaware that his surgeon was the child whose future he had inadvertently altered. Marcus took a deep breath and began the surgery. His hands moved with practiced precision, guided by the surgical microscope's enhanced imaging system and his own extraordinary sense of touch. The diabetic retinopathy had caused extensive damage. Blood vessels had leaked, scar tissue had formed, and the retina was severely detached in multiple locations. For 3 hours, Marcus worked methodically to repair the damage. He removed the clouded vitreous gel, carefully peeled away scar tissue, and used laser photocoagulation to seal leaking blood vessels. His movements were smooth and confident, each decision based on years of experience and an intuitive understanding of ocular anatomy that few surgeons possessed. As he worked, Marcus found himself thinking about the journey that had brought him to this moment. Every struggle he had endured, every obstacle he had overcome, had prepared him for this surgery. The irony wasn't lost on him. The man who had taken his sight was now completely dependent on Marcus's skill to preserve his own vision. But something else was happening during the surgery. As Marcus carefully repositioned Hoffman's detached retina, he began to understand something that had eluded him for decades. The complexity of the procedure, the delicate nature of retinal tissue, the countless variables that could lead to complications. It all became clear in a way it never had before. He realized that Hoffman's surgery on his 8-year-old eye had been far more complicated than he had ever understood. The baseball injury had caused multiple fractures in the orbital bone, severe inflammation, and what the medical records now revealed to be an unusually aggressive immune response. Any surgeon attempting to repair that damage would have faced nearly impossible odds. When Marcus finally completed the surgery, he stepped back from the microscope with a profound sense of completion. Not just because he had successfully repaired Dr. Hoffman's vision, but because he had finally understood the full truth of what had happened to him as a child. Dr. Hoffman woke up slowly in the recovery room, his eyes covered with protective shields. Marcus sat beside his bed, waiting for the moment of recognition he knew would come. "How did the surgery go?" Hoffman asked groggily. "Very well," Marcus replied. "Your vision should be significantly improved once the swelling subsides. You're fortunate. We were able to save most of your sight." There was something familiar about the voice that made Hoffman turn his head slightly. "Have we met before, Doctor?" Chen. Dr. Marcus Chen. The name seemed to trigger something in Hoffman's memory. His brow furrowed as he tried to place it. "I should mention," Marcus continued carefully, "that we have met before. 24 years ago, you were my surgeon at Children's Hospital. I was the 8-year-old boy with the baseball injury." The color drained from Hoffman's face. Even through the post-surgical haze, the recognition was immediate and devastating. "Marcus, little Marcus Chen." "Yes." Hoffman struggled to sit up, his hands shaking. "Oh God, oh my God, but you were blind." "Yes, I was. I am." The words hung in the air between them. Hoffman stared at Marcus with a mixture of shock, guilt, and confusion. "I don't understand," Hoffman whispered. "If you're blind, how could you operate on me?" Marcus smiled gently. 24 years of learning to see in different ways. Your surgery taught me that sight isn't just about eyes. It's about understanding, perception, and the ability to navigate the world with purpose. Hoffman's eyes filled with tears. Marcus, I am so sorry. I have lived with the guilt of what happened to you every single day since that surgery. I retired early because I couldn't shake the image of your parents' faces when we told them you would never see again. I haven't been able to perform surgery without thinking about you. I know, Marcus said quietly. I can hear it in your voice. The same guilt I heard 24 years ago. How can you not hate me? How can you bear to help me after what I did to you? Marcus was quiet for a long moment, choosing his words carefully. For years, I did hate you. I blamed you for stealing my childhood, for forcing me into a world of darkness, for all the struggles and challenges I faced. But becoming a surgeon myself taught me something important. He leaned forward, his voice gentle but firm. What happened to me wasn't your fault, Dr. Hoffman. I've reviewed my case files, studied the imaging from that night, and consulted with other specialists. Your surgical technique was flawless. The complications I experienced were incredibly rare and completely unpredictable. You didn't fail me. Medicine failed us both. Hoffman shook his head, tears streaming down his cheeks. But you lost everything. No, Marcus replied. I lost my sight, but I gained something else, a purpose, a calling, and the ability to help people in ways I never could have imagined. Your surgery didn't destroy my life, Dr. Hoffman. It gave me the life I was meant to live. The conversation that followed lasted hours. Hoffman told Marcus about the guilt that had haunted him, the sleepless nights, the way he had questioned every decision in subsequent surgeries. He had eventually left medicine entirely, unable to reconcile his desire to help patients with the fear of causing another catastrophic complication. Marcus, in turn, shared his journey from that frightened 8-year-old to the confident surgeon he had become. He talked about the challenges, the breakthroughs, and the hundreds of patients whose sight he had restored. He explained how his blindness had actually made him a better surgeon in some ways, forcing him to develop skills and sensitivities that sighted doctors often lacked. I want you to understand something, Marcus said, as their conversation drew to a close. Every patient I've helped see again, every successful surgery I've performed, it all started with that night 24 years ago. Your surgery didn't end my story. It began it. When Dr. Hoffman's bandages were removed a week later, his vision had indeed been restored. The diabetic retinopathy was under control, and he could see clearly for the first time in months. But more importantly, a weight that he had carried for more than 2 decades had finally been lifted. He insisted on meeting with Marcus one final time before leaving the hospital. I want to come back, Hoffman said. I want to work with you, if you'll have me. Not as a surgeon. I don't think I can handle that responsibility anymore. But as a researcher, an educator, someone who can help train the next generation of ophthalmologists. Marcus considered the proposal carefully. What would you want to focus on? Complications, prevention, recognition, management. I want to make sure that other surgeons are better prepared for the unexpected than I was. And I want to help develop new techniques for treating patients who have lost their sight, not just medically, but emotionally and practically. The collaboration that emerged from that conversation revolutionized the field of ophthalmology education. Dr. Hoffman became a leading researcher in surgical complications and patient support systems, while Marcus continued to push the boundaries of what was possible in restorative eye surgery. Together, they established the Chen Foundation, dedicated to supporting blind children and their families, providing comprehensive resources for education, mobility training, and emotional support. The foundation also funded research into artificial vision technologies and genetic therapies for inherited blindness. Their work gained international recognition. Medical schools around the world began incorporating their curriculum on complication management and patient-centered care. Their joint lectures became legendary in the medical community. The blind surgeon and the humbled mentor who had found redemption in partnership. Marcus never regained his sight, nor did he ever want to. His blindness had become an integral part of who he was, a source of strength rather than limitation. He often told his students that his best surgeries happened not despite his blindness, but because of it. When you can't rely on sight, he would explain during teaching rounds, you learn to trust your other senses, your intuition, your understanding of anatomy at a deeper level. You become more careful, more thoughtful, more connected to the patient's experience. Years later, when Marcus was recognized with the American Academy of Ophthalmology's highest honor, he insisted that Dr. Hoffman share the stage with him. In his acceptance speech, he told their story, not as a tale of medical error and redemption, but as proof that our greatest setbacks can become our most profound gifts. 24 years ago, he concluded, I lost my sight, but found my vision. I learned that seeing isn't just about light entering your eyes. It's about understanding your purpose, recognizing your calling, and having the clarity to act on both. In the audience, Dr. Hoffman watched with tears in his eyes as his former patient, now his closest friend and collaborator, received recognition for a career that had restored sight to thousands. The boy, whose vision he had inadvertently taken, had grown into the man who had given vision back to countless others. After the ceremony, as they sat together in Marcus's office, Hoffman reflected on the journey that had brought them both to this point. Do you ever wonder, he asked, what would have happened if that surgery had been successful? If you had kept your sight? Marcus smiled, his fingers absently tracing the edge of a Braille medical textbook on his desk. I probably would have become an astronaut, he said with a laugh. That was my dream when I was 8. I would never have discovered my true calling. He turned toward Hoffman, his expression growing serious. Everything that happens to us, the successes and the failures, the triumphs and the tragedies, they all serve a purpose, even when we can't see it at the time. Your surgery didn't fail, Dr. Hoffman. It succeeded in ways neither of us could have imagined. The man who had lost his sight had become the doctor who restored vision to others. The surgeon who had carried guilt for decades had found peace in partnership with the patient he thought he had failed. And together, they had proven that sometimes our greatest mistakes become the foundation for our most meaningful contributions to the world. In the end, the surgery that had taken away an 8-year-old boy's sight had given him something far more valuable: the clarity to see his purpose, the vision to pursue it, and the wisdom to help others find their way out of darkness and into the light. Sometimes, what we lose becomes exactly what the world needs us to find. The surgeon who took away his sight never imagined that his patient would become the doctor who could see more clearly than anyone. Because true vision isn't about what enters your eyes. It's about what emanates from your purpose, your passion, and your refusal to let darkness define your light. What if your greatest setback is actually your setup for your greatest comeback? What if the thing that breaks you is the very thing that makes you exactly who the world needs you to be?